Hello, my name is Dalton, and my presentation is on physical therapy. So, an intro to physical therapy. Physical therapists work with people of all ages and abilities to maximize quality of life by assisting with rehabilitation from devastating injuries, managing chronic conditions, avoiding surgery and prescription drugs, and creating healthy habits. So, basically, physical therapists are movement experts that work with people that may have something impairing their movement, such as an injury or a chronic condition. Um, or just not being mobile for long periods of time, and basically try to improve that and try and help them get a little bit better in that area. So, a bio on me. My name is Dalton. I grew up in St. Charles, Minnesota, which is a small town, about 3,000 people, I think. I grew up playing all sorts of sports. Through high school, I played basketball and ran track, and then I have done track here at the university for the last 3 years. But when I was younger, I played football, I played baseball, I played soccer a little bit. So I've had experience in all sorts of different sports environments. I'm currently a junior here at UW-Platteville studying health and human performance with an exercise science emphasis. And after I graduate here, I am looking to pursue a degree in physical therapy or a doctorate of physical therapy. My personal strengths and enjoyments, so like I said, I come from a sports background. I played all sorts of different sports. But more recently, within the last 3 or 4 years, I've gotten really into weight training, weightlifting, um, and then different types of sports. I started playing golf, so just having more experience in different areas of movement and different types of movements. I also, being along with that, I enjoy being active, doing things such as hiking and golfing, like I said, and then working more into my personal strengths and things that would develop and be useful in a professional career. I work very well one on one or in small groups with people. I feel as though I can convey my message more easily in one on one situations rather than working in big groups, which kind of suits the physical therapy career. Um, I'm a hands on experience learner, so I can listen to somebody talk and I can learn that way, but I ultimately end up learning better when I am able to do it myself and get practical experience. I enjoy helping others. That's one of my hobbies. It's something that makes me feel good when I know that I can help somebody else and help them improve their life. And I work well with all age groups. So I've been working at the same place for the last 5 years, childcare for the public schools back home. And I've worked with people who are 40, and I've worked with people who are 15, and I've obviously worked with the kids who range from first to fifth and sixth grade. So I've worked with a bunch of different age groups, and I find that I've worked well with all different age groups. The path to becoming a physical therapist. So, a career in physical therapy requires, first of all, a bachelor's degree, and then following that bachelor's degree, you'll need a doctorate of physical therapy degree, which includes a good amount of clinical experience. So, you're going to get all your experience here. A 3+3 program, some of the universities offer where you get your bachelor's degree in 3 years and then the DPT or Doctorate of Physical Therapy degree 3 years after. So it takes 6 total years instead of 7 usually. Then following that, you need to pass the state licensure exam to actually become a physical therapist. So as you can see in this picture, the woman actually performing the movement on the guy is working as one of the students in a doctorate of physical therapy, working under an actual physical therapist and getting that clinical experience. What makes a good physical therapist? Um, Physical therapy requires a lot of responsibility, but being organized and adaptable are very important. If you're not organized, your clients are going to get confused. Um, but also being adaptable because you got to realize every person that you're going to be working with is going to have, they're going to be at a different point in their life. They may have different skills, different knowledge on the topic, and so you're going to have to adapt to each individual person and be able to work well with them no matter who walks through the door into the office. Helpful and understanding, and then knowledgeable also kind of go together. So you have to be understanding that each, like I said, each individual person is going to be at a at a different point, have a different level of knowledge in the topic. Um, and then just being able to be helpful and cater to the individual is important. And then going along with that, being knowledgeable, you need to know what you're doing as a physical therapist. You need to know the components of the body, how the body moves, so that you can teach it to other people. Um, going along with skilled teachers. If you can teach it to a client, what's actually happening in their body or what may be impairing movement, for example, they're going to have a better understanding and most likely be more willing to listen and work with you. Um, Passionate, that's obviously important in any career, I believe, but especially in physical therapy, it's going to take a lot of work. You're going to work with a lot of different people. So being passionate on the topic is going to help you to be more successful and put more effort into your work. And then critical thinkers, there's going to be people who may not work well with you, may not want to listen to you, or may have unusual impairments or need an unusual type of help. So that's where it's the physical therapist's job to be a good critical thinker and develop those plans that may help that individual get to where they need to be. And some daily tasks of a physical therapist. So each day, physical therapists will review and analyze patient medical history. So that's where this form on the right, the PAR-Q form, comes into hand. It's a consent form, but it also has to do with patient history, which is important, analyzing those pre-existing conditions and making sure that we're all being safe and taking care of our client the way that they should be taken care of. Then following that, diagnosing patients based on tests of movement. So test their movement, find out what they can do, what they can't do, what may be injured, what may cause pain. Basically just diagnosing what is actually happening to their body and then developing a plan to fix that, which goes along with educating patients and outlining a program. That's where we're going to make our plan, and then we're also going to educate our patient once we've diagnosed what's actually going on so that they know what's going on. We can actually help them. Following that, we're going to work one-on-one with the clients, going through movements or exercises to improve their mobility or rehab their injury or whatever it may be that they're seeking help with. Showing them proper form, showing them movements, but then also teaching them that they can do it on their own and showing them how to do it following their PT sessions. So some challenges of being a physical therapist. The first one is that critical thinking and quick decision making. You're not always going to get clients who want to be there, or not always usual problems. It may be something new, and that's where it's up to the physical therapist to be a good critical thinker and make those quick decisions in front of the client so that they can effectively help them. And then patience and communication. In this job, you're going to be working one-on-one with people, and some people may not like you, they may not like the way you train, they may think that they know how to do it themselves. So that's where that patience and communication is important, developing a relationship with each client and becoming trusting of one another and then working well together. So collaboration goes along with that too. Just being able to work with people and handle people is very important in this job. So 21st century learning skills, like I said, critical thinking again, it's very important in this job, especially in adapting to each individual, thinking quickly, and then being able to develop those programs to cater to each individual and support their needs. Creativity goes along with that, so sometimes PTs have to be creative, making movements to help people through injuries or exercises, especially if it is new ones that aren't common, or if there's a combination of injuries, or just those certain unique scenarios where PTs have to be creative. Collaboration, like I said in the last one, is important. Building a good relationship with the clients and allowing them to become comfortable is extremely important. They'll get more out of the sessions and be able to faster work together and overall have a better experience. Communication going along with that is important, allowing clients to speak their mind, being able to speak your mind back, just overall communicating what's working, what's not working, being able to convey your message. And then going along with that is also the knowledge component, being able to effectively communicate what you know and adapt it to somebody else's knowledge level so that you can teach them what's important and teach them why they're doing these movements in order to help them. So some tech we're going to see as physical therapists. There's going to be a lot of basic tech, so that's like your heart rate monitors, things that can maybe measure blood pressure, basic health things like that that can allow us to see our clients' levels, make sure everybody's being safe and stuff like that. Progress tracking software, so this could be even just an Excel spreadsheet online, just ways that we can take records and basically see how our client's doing maybe even develop our programs on there, and then you can share them back and forth between a client and a PT. Going along with that is communication tech, so even just something as simple as email or like texting. Uh, you can ask questions to a PT when you're not actually in a session, get instruction, even video calling, stuff like that is all important today. And then video is a very important one. Being able to video, even working directly with the PT or working with a client, being able to video that client and then show them what they look like doing the movement, what the movement should be, just allowing them to basically see themselves in the third person and then review and basically improve form or improve certain movements. Some more advanced tech that we're going to see, force plates. You can see in the bottom right, the graph is of a force plate. So basically analyzing movement, analyzing force, using that advanced technology to our advantage so that we can dive really in depth and see what a client's actually doing and figure out the best way to help them. And then exoskeleton, so the one on the left is, it may not always be as extreme as this, like a full body exoskeleton. It may just be something to assist like one leg or one arm, but basically being able to provide support and assistance to those injured body parts and then allowing them to move them or utilize them in basic ways we wouldn't be able to without this tech. And the final one is virtual reality. So as you can see the guy in the middle, allowing for a more realistic scenario instead of being stuck inside all day or not being able to move, for those, especially for those people rehabbing from long injuries who maybe haven't been able to walk outside on a trail, just allowing them to feel more normalized life. And then along with that, allowing for more movement, as we can see him on the treadmill with the harness there. Overall, a career in physical therapy poses many challenges and requires adaptability and drive. But it's ultimately ends up being rewarding by providing help to others and allowing for problem solving. I believe this suits me and caters well to my skills, interests, and hobbies. Here is my references, and then my resume.